All right, good afternoon, everyone, and welcome to our weekly webinar. Today is 10:10. If you look at your clock, it sort of looks like this, 10:10. So exciting to be with you again, and even more excited to hear from our speaker in just a few moments, Jennifer Faulkner. Before I introduce her, looks like everybody that I can see is muted. Thank you. If you need closed captioning, feel free to use that feature. At the bottom of your screen, you should see a box that says CC and show captions. If you have comments or questions during our time together, use the chat feature, which I will monitor, and then our speaker will be able to address any of your questions or comments um, before we're finished today. Those are all of the housekeeping notes. Some of you got on early enough to hear about my travels through Oklahoma. So always excited to do that and to learn some new things, which I certainly did, and learn some things to bring back to the webinar audience. I will tell you before we finish today who our speaker is next week. But before that, we will hear from our speaker, Jennifer Faulkner. Jennifer is the hospice consultant for Good Shepherd Hospice, and she's going to talk with us today about a topic that can be tough. But as I sort of hinted last week, when we have information and we have education and resources, we can maybe make this a bit less tough. So Jennifer is going to tell us about dementia and hospice care, and she has also agreed to tell a bit of her personal story and her why for why she does this important work, and even more. So Jennifer, I'll turn it over to you. Thank you for being here.
Oh, thank you, Kelly. Thank you for inviting us. My name is Jennifer, and Stephanie is here with us too. Hi. um, so, yes, thank you all for joining today. And I just wanted to touch base and have a conversation with you about, resources, the more you know. So, I am new to hospice. I am new to Good Shepherd. I've just been here about 4 or 5 months now, and I don't have a background in hospice. I think my story is a little bit unique because I felt a calling to come into the hospice world and help families navigate through the process, because I was caring for one of my own family members, and we called in hospice. And, at one of the hardest, most difficult times in our lives, when we have to go through this with a loved one, my family really felt like hospice added such an amazing benefit and was able to care for our entire family, which was very important under the circumstances. So, having gone through that personal experience and seeing the benefits to my family and to my loved one, as we navigated through that, I just really felt like I wanted to do something meaningful. So here I am. I'm very, I'm very grateful to be here today, and hope that information that we provide for you is a valuable discussion on resources that are available to you if you are caring for a family member, or information for yourself as you start along this path of life. So. We love that you have the added support of the KU Alzheimer's Research Center. Kelly and I happened to meet in happenstance, really, at a healthcare expo. So I'm very, very glad that I was able to have this opportunity and we were able to link up. So thank you. um, so a little bit, we just want to have a conversation today, and I'm going to share a PowerPoint. I know those can be kind of not fun, but I'm going to try and just make it a conversation. So hopefully hopefully we have something in the background. You don't have to just listen to me. So Good Shepherd Hospice is a hospice company, and our main focus and mission is to serve patients with compassion and dignity. This is very important to us. We have what's called an interdisciplinary team. It's made up of lots of different people. Again, I'm a hospice consultant. I'm not clinical, and I'm not a nurse. So obviously I'm just one piece of the puzzle that makes up the interdisciplinary team. We have nurses, home health aides, social workers, chaplains, and obviously, our our team with our corporate leadership and all of that. But there are quite a few of us that work together to help and care for our patients, and I think that's a beautiful thing. So I'm going to skip over here to my next slide. And this is just a roadmap. I just put this image up here because this may not be a journey that you have chosen. This is has a different experience, and everyone's experience is unique. And what Good Shepherd Hospice wants to do is just walk through this journey with you. We want to make sure that our care plan and the resources that we have available fit the unique needs of each patient and each family that we work with, and they don't obviously all look the same. So that's really important to us to learn more about your experience and the journey and path that you are on, and how we can help you navigate that. So every resource that we bring to the table is going to have your own unique plan of care and how we can provide that for you. So one of the many blessings of working with Good Shepherd, which again, I personally had experience, with my own family working with Good Shepherd, is that they really did take the time and collaborate and communicate with us on what the process looks like for caring for your loved one, and making the H word, hospice, less scary. I think that is I'm so sorry, that's popping up on your side. Making the H word less scary for families to help them navigate through that. I am going to scooch over to our next slide here. Can you all see that okay? Perfect. So a little bit about what we do. We provide in-home care for a patient and support for the family. We emphasize quality of life over quantity of life, and we treat our patients for comfort, not cure of the disease. So we're really treating the whole person, and that is the patient and the family, body, mind, and spirit, again, to help walk with them through making sure that they are comfortable and treating them with compassion and dignity. Trying to turn that Teams off. I'm sorry about that. We can help the families by minimizing the need to go to the hospital, by bringing the care to you. We come to wherever the patient calls home. So that could be in your home, as I know many patients may be cared for in their home, which is a beautiful thing. But if it's not in their own individual home, we can go to wherever they call home at that time, which is really important to us, that we are a guest in the home, wherever that may be. We focus on pain and symptom management and crisis prevention, so you don't have to go back into the hospital. Your loved one doesn't have to go back into the hospital. We can care for them at home. We have, of course, trained professionals, like I had mentioned before, with our interdisciplinary team. And we have 24-hour access to our hospice physician while collaborating with our attending physician. If you have your own doctor that wants to stay involved just because you have chosen to use Good Shepherd Hospice as a resource, that physician can still be involved and can still have updates from our team. We work with many physicians all over. So a little kind of picture of what this would look like is having a team come in. We would have a nurse come in at least twice a week as needed. to visit the patient. A home health aide would come twice a week. We also, you can volunteer to opt out of these services as well, but they are available to all of our patients and families, which are a chaplain, a social worker, and a volunteer for companionship. A lot of times our volunteers are great assets for coming in if you are caring for your loved one and you need to go to an appointment for yourself, or you need to run an errand, or just need a break, because taking care of yourself as a caregiver is also incredibly important. So our volunteers provide a great benefit in that way. I'm not going to go over these slides and bore you with them, but I did want to put a little bit of information in here. And if Kelly, is able to send this information out, we can definitely get that to you so you can review it later. But basically, we want to serve the patient and their families. I know I keep repeating that, but I just think that's a really important piece, that it's not just coming to take care of the patient, but it's coming to take care of the whole family during this journey. And we focus on care of the patient, keeping them comfortable, and hopefully providing, better quality of life so that they are not in pain. Our commitment at Good Shepherd is to partner with the physicians, hospitals, long-term care, and assisted living facilities as well. So like I said, we're caring for the patient in wherever they call home. I wanted to touch a little bit on, again, the H word. I think the H word can be scary, and hospice and home health are a little bit different in what we can provide. We do provide a lot of the same benefits, but hospice can also help cover with what they call DME, durable medical equipment, and other supplies needed, as well as medications related to the illness, and volunteer support for patients and caregivers. So that's very important. Also for hospice, we at Good Shepherd, and I'll go over this a little bit more, but we will definitely talk a little bit more about it, but our bereavement care. Our bereavement care is very important because we take care and manage and support and provide resources for the family up to 13 months after the passing of their loved one. So we follow the family and we continue that care for them to help them walk through that journey. I think my screen is being a little wonky here. I'm so sorry. Let me scooch on here. I followed many of these bullet points already, but we do have a team approach. Like I discussed, the interdisciplinary team, and the nurses and the home health aides obviously are very important. And then we have the chaplains, the social worker, and the volunteer that are voluntary for you as well. Our phone is answered 24/7 by a nurse, not a answering service or anything like that. Our nurse is on the phone 24/7. So if you are to seek the support of Good Shepherd Hospice, that phone would be answered 24 hours a day, 7 days a week to help you. Our chaplains provide on-site memorials and spiritual support for all denominations. And they don't even need to come and talk about religion at all if you don't want. It's just an extra added benefit of having companionship. I'm going to scooch over to the next one here. I put this in here, and this again is just something that is beneficial for information. This is the areas that we cover in Kansas City. I know many of you might not be in the Kansas City area, but we are still here as a provided resource if you have any questions, or we can help answer any questions for you, even though you might not be in Kansas, Missouri, Oklahoma, or Texas. We definitely are a resource, and we're just here to help. So if there's any questions with that, please feel free to reach out. Gooch over. There we go. I want to talk a little bit about our bereavement support. We have an amazing bereavement program here at Good Shepherd Hospice that is, when I was speaking about my personal experience, was incredibly helpful for my family because we have different ages, different personalities, of course, in the family, and we want to make sure that we care for the whole family and helping them navigate the loss of a loved one. And we follow that family for 13 months following the loss of their loved one, which I think is super important too, because it takes a long time. It's a process, and everybody goes through that grief process differently. I also wanted to add, and I'm personally very proud of this because we had this from my grandfather, and it's the We Honor Veterans program. Our veterans are very important to us, and we have honoring veterans celebrations probably 3 to 4 times a week with all of our patients, and it's a beautiful service that we provide. Obviously, part of support for the family, but also for the patient, making memories and knowing about that person's service is very, very important. So this is a beautiful resource that we provide for the families, and we actually are blessed to be able to be a part of that. Our staff is always, we always have a great turnout of our office there too, just because it's very meaningful and beautiful for the family. So I wanted to share that with you for sure. And then, like I said, this is going to be kind of short and sweet because I wanted to make sure that we are here as a resource to answer any questions. So I would love to open up the floor for any questions or comments that people may have.
Yes, thank you, Jennifer. There are some great questions in the chat. I did my best to give some information about the questions, but I'm sure that you can round that out. And Jennifer, I don't know if you know your camera just turned off. So if you want to turn it back on, that would be great. There you are. Okay.
I don't know why it keeps turning off. I'm sorry about that.
Yeah, no problem. We can go with the first question, which I started to answer and then thought Jennifer could give us some more details. And that was a question about cost for hospice care. And so my short answer was that Medicare covers many costs of hospice care at 100%. But I thought maybe you might want to elaborate on that if you don't mind.
Yes, absolutely. And Stephanie, feel free to jump in also. But hospice is covered under the Medicare Part A benefit at 100%. We also accept several other pay sources if you may not be on Medicare, including the veterans insurance. So all private insurance companies, the veterans benefits, and Medicare we would accept, and there is great coverage for hospice care. I think many people don't. I did not know. I'll speak for myself. I did not know that hospice care was covered under my grandfather's Medicare. And, it was an amazing benefit. And obviously that helps when you know that it's not an added expense for the family.
Yes, great. Thank you. So it sounds like the short answer is that insurance will cover a great percentage. In the case of Medicare, 100%. And for other circumstances, it might depend. And talk with your hospice about specific situations. Yeah,
absolutely.
Okay.
Yes.
And then next in the chat, we've got some great questions from Susan, who wants to know if Good Shepherd has its own hospice facility, as well as when nurses might be available, especially in case of emergency. And then we've got a couple of questions from Susan and another person in the chat about how does someone qualify for hospice? What makes a person eligible and how long can it last? And basically all of that. Jennifer, I'll let you take it from there.
Oh, sure. Yes. And thank you for the questions. I always hate silence. So I appreciate the questions. So Good Shepherd Hospice, we come to you wherever you are located, wherever you call home. We do not have a hospice house. We come to the patient. We travel to you. The nurses are available 24/7, and we provide amazing care throughout the week. We'd obviously set up specific times to come and see you. The nurse will come and see you twice a week. The home health aide will come at a separate time twice a week to help with anything that they need. And then, like I had mentioned, the other trained professionals that we have on the interdisciplinary team that you can opt in to have as a support also. So at least 4 times a week, you would receive visits from Good Shepherd Hospice, 2 from the nurse and 2 from the home health aide. And that would be the bare minimum. Obviously, as you know, the end of life progresses and we have amazing what we call shepherd's care, which we are at bedside with that patient as they start to enter that end of life stage, to make sure that we are vigilant in making them comfortable and staying with them. So that is a huge goal for us, and we are quite successful at making sure that we're with the patient during that time. The second question was the nurse's visits. I think I answered that. Twice a week, a nurse would be coming out, and more if needed as necessary per patient, that sort of thing that would be discussed. Again, we provide a unique situation and care plan for each family because everyone's family is different and the needs are different. The last question, what qualifies you for hospice? And if it's okay, I'm going to let Stephanie jump in so you can hear somebody else.
You're probably going to hear me more than see me, but the easiest way to really describe what qualifies for hospice as the disease starts to progress and we start to see a decline. So I always say you look for 3 things. To be completely honest with you, when it comes to dementia, Alzheimer's, or any cognitive impairment, there are some very specific things, but neither Jennifer or I are nurses, so we'll just say we leave that up to the nurse to go over with you at bedside. But I look for 3 declines that we really watch for. So one is nutritional decline. So are they losing weight? Are they having to be adding in a lot of like boost or things like that because to just keep weight on? So nutritional decline is one. And then the other is, and this one's a little bit tricky when it comes to Alzheimer's and dementia, because this happens early on in the disease process, but so maybe earlier than hospice is actually appropriate, but needing assistance with daily activities. And so as that becomes more and more frequent and there are things that they can't do for themselves any longer, the feeding, the obviously the dressing, those are things you may already be experiencing. But when an Alzheimer's patient or a dementia patient starts to get to the point where they're not transferring well, they're not getting out of the bed, they're not able to really walk and be able to be on their own without assistance, that's a good indicator. It's not necessarily going to qualify or disqualify somebody, but it's an indicator for you to say, I might need additional support. And then the other piece to that is frequent infections. You start to see things like UTIs and other things that start to increase as the disease is progressing and as the patient's declining. And so the nutritional decline, the assistance piece, and then the needing more medical attention, frequent hospitalizations, those types of things. Unfortunately, like I said, with the Alzheimer's and dementia, because of it's so unique with every patient, when things start to transition, that it's never a bad idea to say, I would love for my loved one to be assessed to see what we qualify for, because then we can help set a baseline and determine if today's not the day, that's okay. At least you'll know what to look for and you'll know what the plan's going to be when those things happen. And so it's never a bad day for us to say today's not the day, but at least now we know what we're kind of looking for moving forward. So it's just not as cut and dry with this disease process as it is with some of the others that we may deal with. But unfortunately, many of you may face situations where your loved one has Alzheimer's, but then they also have a comorbidity or another disease process like COPD, congestive heart failure, renal problems. Those things may compound it to the point where they're coming on board for a different disease process, and the Alzheimer's or dementia is just an additional factor, if that makes sense. And then was that any other questions when it comes to that? And I know it was a little bit vague, but just my biggest thing to you is that having a resource, having a safety net in place, and knowing what your choices would be when something does happen, so that you're not having to make a decision in a crisis. And that's really what we want to help you with, is to have those resources in place so that you have a plan and a map already built out, so we can walk with you on that journey.
Yes. I see here that, and tell me if I switched over, I think that
This one was how long?
yes, how long can a person remain in hospice care? So Stephanie, if you want to go ahead and.
So the hospice benefit was originally intended to be a 6-month benefit. So Medicare looked at it and said, if a person is declining and they stayed on the same trajectory, they would probably not be here in 6 months. The reality is, though, that sometimes with the extra support and with the additional team focus, that actually is longer than that. So there are benefit periods, and at the end of that benefit period, a nurse practitioner will come out and do an assessment to determine whether or not eligibility is still being met. And so sometimes we will have people graduate off of hospice, but then what may happen is when that support is removed, that patient may experience another decline and then can go back on it. So Medicare, and usually we just speak about Medicare qualifications, Medicare does not set a limit on how long someone can be on hospice, but that 6-month trajectory is always in question, if that makes sense.
Yes, I think it's also important to know, and I'm repeating because Stephanie already said, that you can come off of hospice and then go back on and be requalified for hospice. It's not, oh, well, you already used your hospice benefit. You can come off of hospice and go back on. I think was definitely something that I was not aware of before I learned more about it. So
yeah.
Let's see here.
And I did notice in I think it was one of your answers, Kelly, was that your doctor, so there's 2 doctors that have to agree about where the disease is at and where your loved one is at in their disease. And so one of those doctors would be your doctor and the other would be our doctor. And so Medicare does that so that there's 2 sets of eyes looking at it, at the patient, so that we're giving them the right resources at the right time.
Yes, thank you, Stephanie and Jennifer. I was looking up some of my resources to help answer the question. So those of you who can see the chat, you might want to take a look at some of the links and the things I dropped there that give some affirmation to what Jennifer and Stephanie have let us know. I think overall, ask as many questions as you have to all of the resources that you have, like the great folks at Good Shepherd and other hospices. All of us at the KU ADRC are standing ready to provide you resources and information. We've recorded today's presentation, so you'll be able to go back and refer to it. And I think Jennifer mentioned that she'd share slides. So if anybody would like to see that information that she shared again, feel free to send email to myalliance@kumc.edu. And I'll be happy to share those with you. Looks like we've got a new question in the chat, Jennifer and Stephanie, about testing for urinary tract infections.
Yes, that is a normal, a standard thing that we would do in the home, that the nurses are always going to look at. Is there something that can be treated versus something that we've decided that we're not going to treat because the outcome of the treatment might go against what it is that we're trying to achieve with the patient. So all of those things would be discussed with the family and determine what next steps would be. So, you know, the one thing, and I know we've used this term several times in this conversation, but it's a journey that we're on with you. So, and you are in the driver's seat, and that's the nice piece of it. We're there as just to kind of give you, you know, hey, there's a left turn up here, be careful, slow down, you know, those types of things. I think of ways whenever I'm like, you know, police officer ahead. So we're there to just kind of let you know coming up ahead so that we're prepared for it, so that emotionally, physically, everyone is aware. And because really, when you take some of the unknown out of it, a lot of the fear goes with that.
Yes, and I think such an important point you both made is that hospice care is not only for the person who gets the diagnosis or the decision for hospice, but also for the family caregiver. And there are lots of respite supports and um, other mechanisms in place so that families can receive the support that they need. And Susan's got another question about whether a patient can change hospice providers.
Yes, yes, Susan, absolutely. This is a choice of the family and the patient. So if, you are being provided hospice and you are not satisfied with that, you can absolutely switch to another hospice. Absolutely. And I would encourage everyone to get information from several different hospice companies, not overwhelming because you already have enough on your plate, but maybe 2 or 3 different hospice companies to collect information. And if you start with a hospice company and you don't feel like they're meeting your needs, then definitely I would encourage you. Families and patients should always have choice.
Perfect. Thank you so much, both of you, Jennifer and Stephanie, for sharing about the great services that hospice care provides. I think it's really important for all of us to know that hospice isn't necessarily a place, but a service. And I think it's really nice to know that hospice care can be delivered in the comfort of one's own home, where we might feel most comfortable. So excellent information. Happy to share if anybody wants to email. We'll be happy to share Jennifer's information, and the recording of today's program will be available at some point later today, and certainly by tomorrow. I want to make sure that you all know that next week, I'm always excited. Every week I say, we have such a great speaker, and so far in a year and a half, almost 2 years, that's always been true. That was true today. And next week, we are having my counterpart. Um, so there are 35 Alzheimer's disease research centers in the United States. That means there's not one in every state, but 35 states have one. And next week we will have Pam Cowley from the Vanderbilt University Alzheimer's Disease Research Center. She plays the role of Kelly in Vanderbilt in Nashville, Tennessee. And she's going to join us next Thursday to talk about what they're getting up to over there in Nashville. I told her that she had to volunteer, Tennessee being the volunteer state, to come on our webinar. And she only rolled her eyes at me a little bit and said, of course, she'd be happy to come and talk with us. You all may be interested in knowing that each ADRC has a kind of a specialty area. At KU ADRC, ours is metabolism. And some of you have heard from Dr. Russell Swerdlow, our director, and he's affectionately known as Mito Man, mitochondria, and talks about cell behavior and dementia. And so that's what we're really good at. We're really good at everything here at KU, of course. So we'll hear next week from the folks at Vanderbilt, what they're doing in terms of the latest and greatest dementia research. So join us. We'll have some more information about that in the next issue of the My Alliance newsletter on Monday, the 14th. And then I'll close by reminding anybody that's a Medicare beneficiary, or if you love someone who is a Medicare beneficiary, that Tuesday, October 15th, starts the Medicare open enrollment period. This is the most wonderful time of the year, as far as I'm concerned. It is the time that you can review your Medicare coverage and make sure you have plans that have the best cost coverage and convenience for you. We did an Alzheimer's and Medicare webinar in August, and it is available on our YouTube channel. And you can know that I am also a Medicare counselor and happy to answer questions about Medicare and Alzheimer's or Medicare and anything. So mark that date on your calendar, Tuesday the 15th. That goes until December 7th. And you want to make sure you take a look at that, make sure you have the best coverage that you can. And we're happy to provide whatever resources we can do for that and everything related to Alzheimer's and other dementias. So with that, we'll finish up for the day. Jennifer and Stephanie, thank you so much for the live performance today, or the presentation. and for letting us record so that folks can access this great information any other time. Everybody have a great week and enjoy this lovely October weather, and we'll see you next time. Bye-bye.
Wonderful. Thank you.